Joining us with easy ways to boost your heart health is renowned cardiologist and author of The Plant Paradox, Dr. Steven Gundry. Welcome back, sir.
Dr. Gundry.
Hey, thanks for having me again.
So these are very easy steps. You say, first up, you should say focus on your good levels of cholesterol, not your bad.
Yeah, that's true. More than half of people who come in with heart attacks to the emergency room actually have normal levels of bad cholesterol, LDL. But what all of them have is low levels of good cholesterol, HDL. So what I try to do is focus on getting your good cholesterol up, and there's a lot of easy ways to do this. One of the surprising things is the less fruit and seeded vegetables you eat, as well as simple sugars, the higher your good cholesterol goes.
When you say fruit,
Yes,
seeded fruit or
any fruit. Any fruit.
Don't eat fruit?
Don't eat fruit. Give fruit the boot. It's one of the principles of the plant paradox. Yeah. Fruit we only ate once a year long ago in fruit season.
And so fruit will affect our
Fruit
HDL?
will lower your HDL.
My one apple a day
Your one
keeps the
apple a day.
doctor away.
Forget about it.
It'll invite me into your operating room. Yeah.
Wow.
Yeah, and I've actually published data on this where we've asked over 1,000 people to lower their fruit and their seeded vegetables like cucumbers, like zucchini, like tomatoes,
Peppers,
and their good cholesterol rose dramatically, including mine.
And are there things to replace it with?
Yeah, so you want to eat lots of olive oil like I've talked about before. You want to eat lots of salads. Tubers like sweet potatoes, like yams are great for you. So
You know what else I'm hearing? Drinking a glass of red wine.
absolutely true. It turns out that numerous studies now show that a glass of red wine or a glass of champagne, ladies,
Thank you.
will actually raise your good cholesterol. But a new study shows it actually cleans your brain of debris. But if
Wait a minute.
you
So we don't
drink,
have to eat
start.
fruit and certain vegetables and drink red wine and things are looking better for us.
Yeah, so
I like where this is
so
going.
I want you to eat concentrated fruit
Okay.
like red wine. How's
Yeah.
that?
But
Okay.
didn't the red wine originally come from a grape?
Yeah, but the sugars got eaten by bacteria. So it's the sugars in fruit that lower your good cholesterol.
All right, high rep weight training.
Yeah, so when you go to the gym, build muscle. And the way to build muscle in the gym is heavy weights and concentrate on your legs and your thighs and your butt.
Because that's where the largest
That's
muscles
where the largest 70% of your muscles are there. Everybody wants to go to the gym and get guns. Guns are not going to raise your good cholesterol. Your thigh and your butt are going to raise your good cholesterol.
And I also heard by working out the big muscles in your body, they continue to burn calories hours and days after you work out.
Yeah, exactly. They actually get hungry,
Yeah.
and it turns out they lower your insulin level, and as insulin level goes down, your good cholesterol HDL goes up.
Get your dose of aged garlic extract. Where do I get that?
There was a cool study actually at UCLA looking at people with known plaque in their coronary artery disease, in the coronary arteries with a CT coronary angiogram. And they put a placebo-controlled study. Half the people got aged garlic extract. They're capsules. You can buy it in any health food store. They took it twice a day, and in a year's time, these guys had dramatically cleaned out the plaque in their coronary arteries. They didn't do anything else. They just ate this garlic extract. I've been taking it for over 15 years because of these studies.
Okay.
Okay, we want to get to these two quickly before we run out of time. Artichokes, you say, and then also tell us what to do when it comes to flossing.
Yeah. So artichokes, the ancient Romans revered artichokes as one of the greatest foods they could eat. It turns out there are beautiful studies that show that artichoke consumption, whether the green ones, the purple ones, the baby ones, lower bad cholesterol and raise good cholesterol. So why not? Flossing. I did a study about 10 years ago now of 300 people who I asked them to floss every other day. Why? Because I hate to floss, and my wife flosses twice a day. She's a wonderful nut, and I hate it. So I said, I can do this for twice a day. We looked at a marker of inflammation that's highly associated with developing heart disease called C-reactive protein. If these people flossed every other day, that went down to normal. And I actually published this in circulation in the American Heart Association's journal. So the dentists love to hear this. It's true. It turns out it gets bacteria in your mouth which get into your bloodstream through your gums and actually cause you to attack the inside lining of your heart.
Oh my goodness.
Yeah.
Every other day.
Every other day is all you need, but if you do it once a day, it's even better.
Water pick as good as floss?
No, flossing is better.
Okay.
All right.
Always good stuff from
Always.
Dr. Gundry.
Shocking.
His book, The Plant Paradox, you can go to gundrymd.com. Thanks for being here. Good to see
Hey,
you.
thanks for having me.
Thank you,
All
Doctor.
right. Still ahead.